Well, Dave, how has COVID-19 restrictions affected South Africa? I mean, here in Michigan, people are complaining about different things that have to go on. And from what I hear, South Africa is just a little bit more stringent even than Michigan was at its most stringent. Is that correct? Can you kind of maybe help us understand that?
Yeah, yeah, that's absolutely correct. I believe the motivation there, the government is concerned for the people who live in the rural areas. We are a country that has, I think, I might get corrected, but it's got one of the highest HIV populations in the world.
Mm.
So there, you talk about comorbidity and people that have issues. There's huge issues. And the government's very concerned with that. And since public transport, which is very different than American public transport is the old, kind of university fraternity thing. How many people can you get into a minibus kind of deal? And so if you can get, 35 folks in a little minibus, that's public transport. And so with that multiplied by 100,000, the government's very, very concerned. So just to give you an idea, we entered the country back in March 17th. We were on just about the last flight allowed in from America to South Africa. And my wife and I have been under house arrest lockdown since March 17th. So we're over 100 days of maybe have gone to the grocery store 10 times, kind of thing. And so the laws are that you're not allowed to leave your house. It's only been recently that you've been allowed to go out and run in the mornings. And so it's slowly coming, but what's happening now is a rise like it is in the States. There's a big rise that's happening in the country. And so we're waiting to see what happens. In the church, it's radically affected our ability to gather. We could only meet with 50 or less. We have to take a register of people who attend, take their temperature, and then go through a significant amount of regulations just to be able to open. No singing, masks, and all of that. Same with the seminary. We have to register every student and then log their movements as we go. We have to have a whole COVID-19 department in the university now. So it's a significant government control over everything. They're very concerned about tracing. They're very concerned. The public health system is not quite what it is in the States, but and that's where the concern comes from. A lot of people lost their jobs. A lot of same economic issues in the States, very same. But there's much greater restrictions. So we rely on technology. Far fewer people have access to full internet, uncapped bandwidth. So we use Facebook and Facebook Live and YouTube and all the things that people download after midnight, and and that's how we function as a church. But fortunately, because we do have a plurality model, our people are subdivided. So we have shepherds over various groups, which really helps. So the people can be cared for, but we're not allowed to visit. I mean, we do. Pastors are considered essential services. So when we have people that suffer from cancer and other things, we can visit them, those kinds of things. So we do what we have to do. But it's severe restrictions where people are really getting more and more afraid to go out as well, because now we're seeing cases rise and we're wondering what's going on. And so it is creating that after almost 4 months of lockdown, there's fear. So there's fear in the church, people that don't want to meet, people that can meet, those kinds of things.